Hi, welcome to Cherry Health Center's educational video about your spine and how spinal decompression works. We'll explain your vertebral column, bulging discs, herniated discs, degenerative disc disease, and spinal decompression treatment. The spinal column, or backbone, is one of the most important parts of your body. It provides you the ability to stand upright, bend, and twist. 33 individual bones interlock with each other to form your spinal column. The vertebrae are numbered and divided into 4 main regions. C1 through C7 are cervical vertebrae, which form your neck, supporting your head, allowing you to nod and turn your head. T1 through T12 are your thoracic vertebrae that are joined by ribs to form your rib cage. Lumbar vertebrae carry most of the weight of your upper body and provide a stable center of gravity when you move. Your sacrum and your coccyx make up the back wall of your pelvis. Inner vertebral discs are located between each of the movable vertebrae. Your disc consists of a rubber band-like outer ring with crisscrossing fibers called annulus fibrosus, which surrounds a jelly-like center called the nucleus pulposus. Discs function like shock-absorbing springs. The annulus pulls the vertebral bodies together against the elastic resistance of the gelatinous-like nucleus. When you bend, the nucleus acts like a ball bearing, allowing the vertebral bodies to roll over the incompressible gel. Each disc works together with 2 facet joints, forming a spinal motion segment. The biomechanical function of each pair of facet joints is to guide and limit the movement of the corresponding spinal motion segments. The surfaces of these joints are coated with cartilage that helps each joint move smoothly. Directly behind the disc, the vertebral bodies create a vertical tunnel called the spinal canal or neural canal. Your spinal cord and nerves pass through the spinal canal, which protects them from injury. The spinal cord is the major column of nerve tissue that is connected to the brain and serves as an information superhighway between the brain and the body. The nerves in your spinal cord branch off to form pairs of nerve roots that travel through the small openings between each of your vertebrae, called vertebral foramens. This is the condition of a normal lumbar intervertebral disc. Degenerative disc disease is the loss of disc height that may impact adjacent nerve roots. When the jelly-like nucleus pushes against the annulus wall, it's called a bulging disc. When the gel-like core pushes out through a tear in the fibrosis wall, it is referred to as a herniated disc. These conditions may impact the surrounding nerves, causing sharp, severe, or even debilitating pain. They may also cause neuropathy, sciatica, and other symptoms. Spinal decompression is a highly effective, non-surgical, and drug-free treatment for these conditions. Cherry Health Center was the first medical facility to offer spinal decompression in the Springfield area more than 20 years ago. Cherry Health's spinal decompression machine, the DRX 9000, is the world's first disc therapy that is able to target specific disc level, automatically adjusting itself 13 times per second and gently pulls utilizing a logarithmic curve. These factors ensure that each of our patients experience an ultra-smooth and relaxing treatment that is delivered with consistent precision to give you relief. Research and findings by medical doctors associated with the Mayo Clinic, Stanford, and Johns Hopkins all reveal that patients who qualified and underwent the spinal decompression treatment had an 88 to 90% success rate. During a comfortable 30-minute treatment, the pressure inside your disc is dropped by more than 200 millimeters of mercury, creating a vacuum-like effect, bringing nutrients and fluids back into your discs. In the case of degenerative disc disease, nutrients and fluids are brought back into the disc, increasing your disc height. In cases of bulging discs, the incredible negative pressure created inside the disc brings the nucleus pulposus back to the center. Similarly, in cases of herniated discs, the jelly-like nucleus comes back to the center. As a result, it takes pressure off the impacted nerve roots, relieving patients of their pain and related symptoms. Thank you so much for watching. If you'd like to learn more or set an appointment, go to cherryhealthcenter.com. And don't forget, if you found this informative and helpful, give us a like and follow.